If you're on Ozempic or another GLP-1 drug, can it actually reverse fatty liver? And if your scan says fatty liver, is this finally the treatment? Or are we confusing weight loss with liver therapy? Today, I want to separate biology from headlines and metabolism from marketing. Can Ozempic reverse fatty liver? When people ask whether Ozempic reverses fatty liver, the answer is more nuanced than social media suggests. GLP-1 medications are not direct liver drugs. They are not like antibiotics targeting infection. They do not treat liver specifically. They change the metabolic environment of the body. If fatty liver improves, it improves because metabolism improves. That distinction matters, especially in a space where drug names can sound organ specific. This distinction matters, especially in a space where drug names can sound like organ specific solutions. What causes fatty liver in the first place? Fatty liver is not a toxin problem. It is not waste that needs flushing. It is a metabolic storage problem. Fat accumulates inside the hepatocytes, the liver cells, when insulin resistance and excess energy push fat into the storage pathways. The liver becomes a holding depot for metabolic overflow, and over time, that fat can trigger inflammation. And in 20 to 30% of people, inflammatory injury in the liver progresses to MASH, which means fatty liver inflammation. If this inflammation persists, the liver attempts to repair. That repair lays down collagen. Collagen becomes fibrosis, which is early liver scarring. Fibrosis over years can distort liver architecture and eventually lead to cirrhosis, meaning advanced scarring. So the disease spectrum moves from fatty liver, to inflammation, MASH, to scarring, which is liver cirrhosis. The earlier the stage, the more reversible it tends to be. To give you a sense of scale, not everyone with fatty liver progresses. If you imagine 100 people with simple fatty liver, roughly 20 to 30 of them may go to develop steatohepatitis, inflammation of the liver. And of those 20 to 30, perhaps 5 to 10 over time may progress to advanced fibrosis or liver cirrhosis, meaning more severe and permanent damage, permanent scarring. So progression is real, but it is not inevitable. It is usually happening over years, not months. That is why early metabolic correction matters. You're not trying to treat cirrhosis, you're trying to prevent inflammation from becoming scarring in the first place. Which brings us back to the core issue. So the real question is not detox, it is metabolic correction. What do GLP drugs actually do? GLP-1 medications reduce appetite, improve insulin sensitivity, slow gastric emptying, and help people sustain meaningful weight loss. MRI-based studies consistently show reduction in liver fat content in people using these drugs. Biopsy trials show higher rates of MASH resolution compared to with placebo. MASH is fatty liver with inflammation, but the mechanism is indirect. GLP-1 changes appetite and metabolic signaling. Weight decreases, visceral fat decreases, insulin resistance improves. So those upstream drivers improve, and as they improve, liver fat and liver inflammation often improve downstream. MASH improves with metabolism improving. GLP-1 helps metabolism. It does not directly treat the liver. What improves and what doesn't? Now we come to nuance. Improvement in steatosis, meaning liver fat, is common with meaningful weight reduction. Improvement in inflammatory activity is also seen, especially when weight loss is substantial. Fibrosis is different. Fibrosis represents structural change. It is scar tissue laid down over time. Early fibrosis, meaning early liver scarring, can regress when underlying metabolic injury is removed. The liver does have regenerative capacity, but more advanced scarring responds more slowly and less predictably. It is permanent. Some recent trials show modest improvements in fibrosis stage, meaning the degree of scarring with GLP-1 based therapies. However, the effect is smaller and takes longer compared with improvements in fat and inflammation. In the USA, Semaglutide has now received accelerated approval for certain patients with MASH and fibrosis. But even then, the benefit reflects metabolic change over time rather than direct scar dissolving effect. So we should not oversimplify this as a quick reversal story. If someone has mild fibrosis and achieves sustained metabolic correction, regression is possible. If someone has established advanced scarring, the goal may be stabilization rather than a full reversal. That is why early identification matters. Fat is easier to reverse than scar. Is this just a modern liver detox? Many people still think in terms of liver detox. That language has been around for decades, but fatty liver is not a toxin buildup problem. Short-term cleanses do not remove fat from liver cells. There is no pathway by which a weekend juice reset empties the fat from the liver cells. Sustained weight reduction does. Sustained improvement in insulin sensitivity does. So consistent metabolic change does. This is not about flushing the liver. It's about rebalancing energy storage and signaling. Do you even need medication? No, not everyone with fatty liver needs a GLP-1 drug. If someone achieves 10 to 15% body weight reduction through sustained dietary change and physical activity, we often see similar reductions in liver fat and sometimes resolution of MASH, of liver inflammation. In some studies, weight loss above that threshold correlates strongly with histological improvement. GLP is one tool. For some people, especially those with severe obesity, long-standing insulin resistance, or repeatedly failing weight loss attempts, it can be an effective metabolic lever. But it is not the only path, and it is not a liver-specific cure. The therapeutic target remains metabolic health. If someone already has advanced fibrosis or cirrhosis, management becomes more individualized. GLP-1 therapy may still be beneficial for weight and metabolic control, but expectations has to be tempered, must be realistic. Reversing cirrhosis is rare. Stabilizing the disease, stabilizing the progression, and reducing cardiovascular risk may be more achievable goals. Progression happens in a proportion of patients, but it is not inevitable, particularly when metabolic drivers are corrected. It is also important to remind ourselves that cardiovascular disease remains the leading cause of mortality in people with fatty liver disease. Improving metabolic parameters protects more than just the liver. This is whole body medicine, not single organ magic. So if you have fatty liver, the question is not how do I detox my liver? It is not even, is Ozempic a liver treatment? The better question is, how do I sustainably improve my metabolic health? GLP drugs can help some people achieve that, but the mechanism is metabolic correction. When metabolism improves, the liver often follows. When metabolic injury persists, scar accumulates. No medication can replace biology. Fat is easier to reverse than fibrosis. Inflammation is more responsive than advanced scarring. Early action gives you the greatest leverage. Fatty liver is common, it is quiet. Early disease is often reversible, but it is reversed by sustained metabolic change, not by flushing, not by short term resets, and not by assuming a single drug is a cure. Clarity reduces fear, precision reduces hype, and sustained change, not shortcuts, is what protects the liver long term, and that what protects you and I.